Pulse by healthjobhub. My name is Prashanthi Naidu, founder of healthjobhub.com. I started Pulse to connect with all you amazing people, share incredible stories, and to be inspired. My mission is to unveil the pulse behind the pulse. Today, I have a very special guest joining us live on Pulse. It is my honor and privilege to welcome Dr. Arnold Chetty to our show this morning. Good morning, Dr. Chetty. Thank you for joining us. How are you this morning?
Hi, Prasanthi. Thank you so much for having me on your show. I'm well, thank you. How are you?
I'm very well, thank you. And it is indeed our pleasure to have you. To all our viewers, Pulse by HealthJobHub is a live talk show. So if you have any questions, please ask. If you are watching the show after the fact on another social media platform, please ask away. We will answer your questions. If you enjoy our show, please smash the like button and share with your network. I'd like to thank our sponsor, HealthJobHub, for sponsoring this show. Find your dream job in healthcare on healthjobhub.com. Dr. Chetty, when I read your electronic signature, your letterheads, and your LinkedIn profile, I can't help but to notice the lengthy string of alphabets behind your name, which is B Optom, FOASA, MBCHB, MBA. I'm sure you've had to study many, many years. Please share with us, what does each of these letters mean?
The first one means Bachelor of Optometry, Fellow of the Optometric Association of South Africa, Bachelor of Medicine, Bachelor of Surgery, and Master of Business Administration.
Wow, that is super impressive. Goodness. What inspired you to start your career in optometry and then go on to pursue a career in medicine? Please share your journey with us.
I think what inspired me was my faith, my friends and family, but more especially the fear of failure. I knew in life I didn't want to become a failure. Having cousins and uncles who are nurses and doctors, my mom was a nurse as well. So I decided to get into the health sciences. I had good friends along the way, and I remember meeting Dr. Randeria in third year optometry, and he planted the seed of getting into medicine. I completed optometry, I opened up my own practice, and I had my senior colleagues work for me whilst I did medicine. So I ran a business and I did medicine at the same time. After completing medicine, I went to specialize in surgery. I did a bit of general surgery, plastic surgery, and neurosurgery. Didn't complete it, and I left to Ireland. When I went to Ireland, I worked in numerous hospitals. I worked in County Louth, in Navan, in Tullamore, in Cork, and Limerick as well. Thereafter, I was chosen to be the clinical lead doctor of a private urgent care clinic in Dublin. I was to oversee 2 clinics. And thereafter, I was fortunate enough to get into an MBA program in the UK. I went to business school. And at the moment, I'm a registered doctor in South Africa, Ireland, and Canada. And my passports allow me easy access to work and live freely in these countries.
Oh my goodness, wow, that is incredible. Your latest professional designation is Clinical Assistant Professor at the University of Calgary Cumming School of Medicine. Heartiest congratulations on this excellent achievement. What does this role entail?
Thank you for your kind wishes. I am attached to the University of Calgary as a clinical assistant professor. The role involves me in mentoring and teaching the medical students in clerking and examining patients. Hopefully they can learn from me and become better doctors, and I can make a small contribution to their medical career.
Business MBA, founder and CEO of Proudly Irish. Please share your story.
My passion for business started at a very young age. I completed optometry at age 21. I opened a practice at age 22. I ran the business and I also did medicine at the same time. I hired my senior colleagues to run the practice for me. My brother also played an integral part in my practice. He helped manage the practice as well. I completed my MBA in 2013 at Durham Business School, and we ranked 62 in the world from the top business schools in the world.
Wow.
At the moment, I founded and I own Proudly Irish, which is a licensing company. We are a startup company, and we own the registered trademark for food and clothing in Ireland.
Super impressive. What advice would you offer young people contemplating their careers at this stage?
You know, people always say the sky is the limit.
Mm-hmm.
The sky is not the limit if there's footprints on the moon. Also, there's no limits to the speed of mind. You makes you. Do what you like. Don't use others as a yardstick. And always remember, there's no sunshine without any shadows. The three things that I live by, it's GAP, G-A-P,
Mm-hmm.
goals and targets. A, act with urgency. And P, be positive. And always remember, if you have 1% chance, try 100 times.
I love that. Wow, that is super advice, and I really hope any young people that's listening out there will be truly inspired by that great advice. Thank you for sharing that. In creating Pulse, one of our goals is to have our finger on the pulse. With regard to the widespread global pandemic COVID-19, also known as coronavirus, how does this impact frontline healthcare professionals like yourself? Doctors, nurses, and other healthcare staff who do not have the luxury to work from home like the rest of us? And what advice can you offer all of us globally who are consumed with fear and anxiety over coronavirus?
Well, firstly, I take my hat off to the frontline staff, the doctors, nurses, administration, and all those allied healthcare workers globally, especially working in the hospitals, trying to save lives and help others every day. I stand shoulder to shoulder with them, and I totally understand the dedication and the sacrifice they are making on a daily basis. My advice is to wash your hands regularly, not to shake hands, reduce your exposure to crowds, stay home, self-quarantine if needed, reduce exposure to those people who have traveled. Those who have traveled and are unwell, you should self-quarantine for 14 days. I just heard now that Ireland is in lockdown, as well as Italy is in lockdown, and there's talk about South Africa being on lockdown at the moment.
Wow. Yeah, this is incredible times we are living in. It definitely is the unknown. And thank you for sharing that great advice. I've been following you on Facebook, and I see that you had posted something about your theory of normalcy. Do you mind sharing a little bit about that with us on our show today?
Sure. So with regard to theories, my theory is that anyone can make a theory. Like, for example, Darwin has made a theory. Up to today, there is no fossil evidence to prove his theory. Isaac Newton also made a theory. My theory of normalcy is rather a basic one. I suppose just like for every action, there's a reaction. The theory of normalcy meaning is when things go wrong, everybody wishes that they could have what they normally had before. They don't wish for something better than what they had before when things go wrong. They just want to be back to where they were normally. Theory of normalcy is that when things go bad, people wish they could have what they had before. rather than having it better than what they had before.
Mm-hmm.
That's the beauty of normalcy.
Oh, that is awesome. And that is so true. We all find ourselves often saying, I just wish things were just back to normal. So that is a great theory. And I think you should document that. It's amazing. Physicians in Alberta are currently up in arms about the looming pay cuts on April 1st. In light of coronavirus, please share your views on this radical and unpopular decision by the Alberta government to cut physician pay, especially knowing firsthand how mentally exhausting and physically challenging it is to be a frontline worker in a pandemic situation.
I think you hit the nail on the head. It is a radical change and implementation come April 1st. I think government needs to have a proper sit down with those who have their finger on the pulse at ground level. I think going forward with the current climate changes and with regard to the forecast for our province, it's going to have a negative impact.
Mm-hmm.
See practices being closed down, there'll be longer waiting times. As a practice works as a business, you'll find that MOAs or admin staff, the jobs may be lost.
Mm-hmm.
You'll get doctors retiring earlier than usual.
Mm-hmm.
You may get doctors resigning earlier than usual as well.
Mm-hmm.
And with longer waiting times to get into GP practices, you're going to find that patients will turn to the hospitals. And that's going to cause unnecessary stress
Mm-hmm.
to and colleagues working in the hospital.
Mm-hmm.
I think government needs to have a meaningful dialogue with the doctors so that we can work our way forward, and wherever there's a problem, there's a solution. So I think instead of acting irrationally and impulsively, I think government, especially now with the coronavirus being prevalent globally and a pandemic,
Mm-hmm.
now is not the time for cuts. I think our ministers and government per se
Mm-hmm.
should definitely reconsider it,
Mm-hmm.
halt it for April 1st, even if it means going back to the tables, have a proper sit down, and I'm sure we can work through this together in a very meaningful and achievable manner.
Thank you, Dr. Chetty. You know, I hear what you say, and I only hope that government is listening as well, and they would take heed of this advice. Thank you for sharing that. St. Patrick's Day is fast approaching on Tuesday, March 17th. Any final sentiments you wish to share?
Yeah, sure. I lived in Ireland for 10 years. I am Irish. I own an Irish company. I think the sad thing is that in Ireland, they only got 266 ICU beds.
Oh,
They
dear.
predict 66,000 people will have coronavirus.
Oh, my
We
goodness.
to see a lot of deaths, unfortunately. And what's so sad about it, it is around St. Patrick's Day, which is March 17th.
Mm-hmm.
Understanding that, I would like to use your platform to wish my fellow Irishmen well, globally, for St. Patrick's Day, Sláinte.
Thank you, Dr. Chetty. And thank you for enlightening us this morning and sharing your incredible story on Pulse. This brings us to a close of our second Facebook Live show for Pulse by healthjobhub. I do hope you enjoyed the show as much as I did. Please join me next week, same time on Facebook Live. I'm excited to announce that our special guest joining us next week is Dr. Christiane Shrug, plastic surgeon and humanitarian. Dr. Shrug volunteers with the Operation of Hope organization and goes to Zimbabwe and performs life-changing operations on children and adults in need of plastic surgery. Please join us again next week to be inspired. And please don't forget, if you enjoyed the show, smash the like button and share it with your network. Thank you.